Welcome, I'm Dr. Robert Glatter, Medical Advisor for Medscape Emergency Medicine. Today we have Dr. Mike Varshavsky, otherwise known as Dr. Mike, a family medicine physician and well-known social media medical influencer, joining us to discuss how he has spent the past several years debunking medical misinformation, helping to allow people and healthcare providers alike make better informed decisions about their own healthcare during the pandemic and beyond. Welcome, Dr. Mike. It's a pleasure to have you join us at Medscape today.
Thank you so much, Dr. Glatter. Really excited to be here, speak on this subject that I'm incredibly passionate about.
I wanted to start by really asking you about how you approach patients when they come to you with, bits of medical misinformation and myths that really, obviously don't clinically make sense.
Yeah, the main reason why I actually got into posting videos on social media was because of my frustration of seeing patients being misled on something that they've seen online or even on television, thinking that was a shortcut to success for them to have a healthy outcome. When in reality, that success would only come through putting in some level of effort, whether it means getting a good night's sleep, eating a healthy, varied diet, putting in the work to go to the gym. And it's very tempting for them to see a shortcut miracle cure all supplement on social media and wonder, why is my doctor not recommending me that? So it was my experiences during my residency that really inspired me to say, we need to do a better job in media at debunking this misinformation. And I think it really stemmed from the fact that there was an absence of quality evidence based physicians online doing it effectively.
Absolutely. And I think that's important. Traditional medical and healthcare systems have shied away from social media in the beginning of things. And I think you're aware of this. And now it seems like every hospital is online, either on TikTok, they're on Instagram, Facebook. And that really is the way to get to the population and to reach your audience. So I think clearly now that there's been this sort of bandwagon where everyone has jumped on, as you point out, it's very important to have evidence-based and accurate information. Could you highlight some of the most egregious examples of medical misinformation from videos you've encountered on various social media platforms?
Yeah, for me, the scariest ones are the ones that start debunking the trust that we have with medical institutions, that start spreading conspiracy theories, whether it's about the COVID-19 vaccines, COVID-19 testing. I mean, right now, the problem of misinformation has been extremely highlighted because of the pandemic that we're in and the importance of fighting back against that misinformation. For me, that was a goal even prior to the pandemic, but it got quickly accelerated with the need to put out accurate info. That's why, despite me being a younger doctor, the viewership on the videos educating on the misinformation that comes surrounding the vaccines are in the millions. And these are millions of people that are skeptical. They don't know what to believe. They're looking for some guidance. And recently, there was a frightening report that younger demographics are using TikTok as their main search tool. They no longer go on Google and type in COVID-19 vaccine. They now do it on TikTok. And that's very dangerous because that's a place where I've seen misinformation thrive.
Absolutely. I think, if you're going to use TikTok and as a search engine, that's really, problematic. And I think that's very important that you bring that up. Um, and I think, this is the uphill battle is that as social media evolves and they have the search capability, this is what we're dealing with.
Yeah, we as doctors can look at a video of a social media wellness influencer talking about water, different types of water being more acidic than others, and that you need to drink basic water. And we could see how ridiculous that is because we know once the water goes into your stomach, there's gastric juices there that are so acidic that it doesn't matter if your water is a pH of 6, 7, or 8, but the average person doesn't know. So they feel like they have to spend what limited health budget they have on that water as opposed to joining a gym, buying the healthier vegetables as opposed to the processed foods in the supermarket. So it's really about guiding people with our experience, but doing it in a relatable way. And that's where I seem to have the most success.
Right. And I think that's a very important point you just brought up, being relatable, and that people are sometimes flooded with statistics and data and papers and other videos. I believe you mentioned this, but getting really to the human level and to connect with patients. That's something that you are excellent at. Maybe you can expand on that.
Yeah, as a family medicine provider, I learned early on that even if you have a patient that fundamentally disagrees with you on a given topic, highlighting that disagreement early on only stems to make the problem worse. So if I have a patient that's coming in that is vaccine hesitant, my goal isn't to flood them with misinformation and prove them wrong. It's instead to find points of which we agree upon. So saying that the illnesses that we're looking to prevent with vaccines are dangerous. Boom, we agreed. Talking about that their children's health is what I'm trying to optimize as best as I can. Boom, we agreed on something else. Because it's very easy from our training, of which we have very limited communications training, to just give the statistical data that we know to be true, but then the patient might not know to be true. So instead, it's finding lines of communication upon which we agree and work outwards from there. And one of the biggest policy changes that I've seen happen across certain offices, both pediatric and family medicine, is stopping the practice of removing patients if they are vaccine hesitant. Because before this used to be a policy, and now what we've realized is by excluding them from our practice, we're essentially guaranteeing that they're not going to get good evidence-based care in the future.
To just remove a patient because they, don't agree with what your views are is just really not appropriate. And I think that, having that open discussion is so important. And developing that trust and restoring that trust in mainstream medicine. I think a problem is that I see is that, Generation Zers, millennials, a lot of them don't have family physicians, internists. They just go to urgent cares. And so without that sort of grounding, they can't establish that relationship. And that's a problem, especially with the plethora of urgent care. And maybe you can comment on this.
Yeah, urgent cares fill an absolute gap in care in our current healthcare debacle, if you will. But a lot of younger folks rely on them as a quick fix for their chronic problems. And quick fixes for chronic problems are non-existent. If it took 10 years to create a problem, it's not going to go away with a single urgent care visit. Sure, you could put a band-aid on the problem, but you're never going to get a solution. And that's my goal as a primary care doctor. And what I try and highlight, even when I'm doing videos reacting to The Simpsons or watching the show Survivor, it's explaining in a transparent, relatable manner, using something that's very known to the audience, like these shows, that what my thought process is like, what I think about when a patient walks in through my door with a certain problem, the types of questions that I'll ask, the reasons for certain tests that I would run versus not run. And when patients start getting on the same page as to your mindset, your thought process, that's where you get good outcomes. And it's interesting that we're speaking about this from a very medical heavy focus versus a patient focus, because we also see that malpractice lawsuits drop when you are open and transparent with your patients, when you give your reasoning as to why right now you don't think they warrant a CAT scan for their abdominal pain when they're worried about appendicitis. Because it's only upon them seeing your mindset and the reasoning as to why you're choosing not to order it or choosing to order it, will they be feel like they're in control of their health and they're on the same team as you, as opposed to a very antagonistic relationship.
Right. I think it's not talking above them, but talking to them, as a human being and how you want to be spoken to. Because let's face it, there's a lot of medical jargon. It's scary and it's hard to use plain English to just talk to patients. And we all, try to focus on that. People in the media like yourself have a knack and really a great ability to just talk plainly and to talk normally and not use medicalese and all this jargon, which scares patients quite a bit.
I think I'm lucky in the sense that being a younger doctor, I haven't spent decades speaking only to other doctors and other specialists, where I still am accustomed to using the common language for a lot of these conditions in ways that I've learned them in my training. So, because of that, I feel like I have a clearer way to describe certain illnesses to patients. I remember, even for myself as a med student, being in a room with one of the top cardiologists in our hospital system. They're explaining to a patient their diagnosis, the potential treatments, and everything's spot on. Science, it's all there. But then when they walk out, the patient looks at me and they say, "What did they say? I have no idea." And I kind of had to translate there. And I realized that there's a gap in this knowledge. And that's not to say we need to throw away the basic sciences in medical school education. It's to say that we definitely need to find a way to incorporate better lines of communication.
Right. I think communicating with patients and, doing media, as you do, gives you the ability to connect with people and to, bring things down to their level. And we're by no means saying that patients are not, smart or able to grasp concepts, but we just want to make them very simple, very down to earth, and things that they can relate to.
Yeah, and I also would almost push against trying to simplify or oversimplify or being paternalistic in that nature to our patients. Because what ends up happening in mass media communication is that if you start infantilizing your audience, they will pick up on that and they will see through it because we as humans have a naturally good BS detector. And early on in the pandemic, the CDC and the FDA we're making recommendations that were correct at the time with the evidence that we had. But they were doing it with some level of foresight into predicting what the patients or the viewers would do with that information. And when you do that and you infantilize and you present the information as if you know all, that's where you start running into trouble, as we've seen.
Right. Science changes, it evolves. And that's one of the basic tenets we learn, in our medical training. And that, the public, wants, the definitive answer, but often we don't have the definitive answer. And it's very frustrating. I'm sure you can relate to that.
Yeah, that's probably the most frustrating part of debunking misinformation because for me to prove that something doesn't work is much harder, if not impossible, than for them to just say that it works. I could say, but just by sitting here, you'll get so much stronger. For me to prove that wrong, I would have to run randomized controlled studies to prove that, whereas they can say whatever they want. And it's really about explaining why I think that is not correct and really take some liberties because in science again we can't say that this is definitely untrue but we can say based off our scientific opinion based on the lack of research we're saying it's untrue.
A lot of medical practices now are online, either Instagram, TikTok. They're flooding our feeds, and they certainly, I think, in some ways, are trying to grab Generation Zers, millennials, who don't want traditional medical care, in the office setting. And so, how do you feel that these medical establishments or these practices are doing right now? What's your assessment? Their online presence.
Yeah, their online presence of encouraging people to seek out care, especially from a primary care provider, is amazing. And I want that to happen more often. Where I run into troubles is these medical websites and practices where you essentially self diagnose yourself with a condition and make a request for a medication. When you start as a patient asking for a medication before knowing what your true diagnosis is, what the risks are for the medicine, what other potential diagnoses could be on the differential, that's where you run into trouble. And I've seen these websites pop up for a $20 visit where it's not even really a visit, and all of a sudden they're prescribing you finasteride for hair loss. They're prescribing you sildenafil in order for you to have erections. But the problem with that is when they come into my office, I might be able to write the same prescription. I might want to write the same prescription, but at the same time, I would be doing some education or perhaps ruling out other conditions like diabetes mellitus to make sure that they're not having a neurological or pro-inflammatory state. So there's a lot of medicine that is missed virtually, but there's definitely utilization for certain visits. Like I love with my patients who are diabetic to have a visit to check on how their sugars are doing. If it were just going to make a small medication adjustment as a follow-up, this could be a great tool. But it's not a great tool when a patient wants to make a virtual visit for abdominal pain. I cannot do a proper assessment with a virtual visit. And that's where we need to really be thorough and almost skeptical of the commercialization of online medicine because it's very easy to get good reimbursement now, but not very good to do a quality physical exam.
I agree, and I think access is certainly there, but making sure people have long-term follow-up, as you allude to, is important. Grabbing them and giving them access is one thing, but really the finer points like that you're discussing and you just mentioned regarding medical conditions are very, very important.
Yeah, and I'm hoping that by watching some of my silly TikTok reaction videos or medical memes, I'm using some of the principles that a lot of these snake oil salesmen have used to pollute the medical media space and instead use it for good. All these miracle cure-all potion marketers are amazing at grabbing attention, keeping attention, and encouraging follow through. So if I can learn what they do well and use the same tactics on my YouTube channel for evidence-based medicine, I think that's a win for everybody. I will say in the future, some of the social media platforms are going to be working with major organizations like the WHO, the National Academy of Medicine, to find better ways to verify these talking heads that are spouting medical information, whether it's right or wrong, on social media, and validate whether or not they are who they say they are. Because at the end of the day, anyone can put on a white coat and say medically sounding words. The question is this a real person? Do they have a license? Were they educated properly? And currently on social media, that's very difficult to tell. But I'm hoping in the future months that problem can be at least somewhat ameliorated.
It's almost like having an accreditation. You've been given that stamp of approval, so to speak. And I think you're kind of alluding to that, that, you've passed certain, conditions, or you have, certain basic tenets and principles where you adhere to, and they are a trusted site. Similar to what like Twitter has done, they verify physicians. And I think in a general context, to have that stamp of approval.
Yeah, because otherwise I feel for my patients because if they're looking up, even whether it's on TikTok or Google or YouTube, medical information, I actually want to encourage that. I love that they're interested about their health. I want to keep pushing that passion forward. I don't want them to like. There's older doctors that I work with that say, "Stop going on social media. Stop doing it. Don't do a Google search before you come in." No, no, no. Do it. Get your questions down on paper before you come in so that you're more prepared for the visit. Who doesn't want a more engaged patient like that? I think that only is going to yield better and better outcomes.
I agree with you. I think let them have the questions and then, pose it to you. And then you can, certainly inform them. And I think this brings really to the issue of restoring trust in mainstream medicine, and that, by doing this, by being receptive to people who do, go on social media for information, which we all do, to just, validate it and verify it.
Yeah, and a lot of that it stems from a very simple act that I actually partnered with the WHO on. That's called pause before you share. And as you're aware, we have this rational mind that takes a little bit longer to kick in, takes a little bit more metabolic effort to properly think through. And then we have our emotional reasoning centers where we're quick to judge, quick to get angry, quick to share something that outrages us. So by taking a moment to share, by taking a moment before you share, you could actually stop the spread of misinformation or at least slow the spread of misinformation because ultimately it's these factors that these algorithms use to decide what to make explode, what to decide to share to its viewers. And if we can decrease those signals on our own with certain efforts like just taking a pause, I think that's a win for everybody.
Yeah. And one thing recently I read was that, people's trust in the CDC, for example, is just, plummeted. And we all know this, obviously with, communications failures. But I think reestablishing this through, valid means, on social media with trusted, organizations like you're alluding to, and physicians that represent these organizations might be a step in the right direction.
Yeah, I think it needs to start with transparency. Transparency solves so many problems. Whether we're talking about lowering pharmaceutical costs or improving the trust that individuals have with the CDC, it needs to start with transparency and honesty, and the decreasing of politicization of these topics. And that's not to say politics aren't a part of health. In fact, politics are a crucial component of public health, but it's important to not villainize certain parties because again, by villainizing someone who disagrees with you, you're essentially doing what we were talking about at the beginning of this conversation, where you have a patient that comes in with an opposing viewpoint. And instead of finding points to agree upon, you're starting the conversation with the patient disliking you very much. And that's essentially what happened over the last few years. And I say that from a perspective of someone that worked with the Trump administration, putting out information about COVID-19, and the Biden administration. Both of them allowed me to interview Dr. Fauci on my channels, have very open discussions. And this is the point of transparency that we need to hit hardest. Dr. Fauci did not ask for my questions in advance. He did not ask to see the videos before they were published. And this is a person that he doesn't know well, that I'm going to ask hard questions. And that's the kind of leadership we need to continually see from these major organizations.
I completely agree. I saw your interviews with Dr. Fauci; they were excellent, and I also saw your interview with Dr. Murthy. our Surgeon General, and I thought it was right on point. I think getting more of these officials on social media channels to reach you know the public at large would be, I think, a step in the right direction because they need to hear them.
Yeah, I'm hoping that your viewers um, get excited about this as a potential tool to reach millions of people. I'm one person, but I see 40 patients a week in my limited part-time practice. But on social media, my viewership ranges from 60 to 100 million a month views. And that's evidence-based, accurate information. I will never, as a physician, be able to educate that many people in my practice.
That number is just, I mean, we're talking about almost nearly like well over a third of the U.S. population. So that's incredible, Dr. Mike. I really appreciate you sharing that.
Yeah, thank you so much. And it's not to say everyone needs to be on social media because it's certainly not easy. A lot of people think it's something you could just do in your spare time. It's just like running any other business. It takes commitment, time, energy, understanding of what works, what doesn't. But if you have a passion for it, there are ways to find out more. There are organizations that are looking to teach medical professionals how to be better at this. And I encourage everyone to seek out that information if they are passionate about it.
Well, this has been great. I really appreciate you joining us to educate our viewers and give our audience your point of view and how you've been so successful in the world of social media. Thank you again for joining us. Truly appreciate it.
Thank you so much, Dr. Glatter. Have a great one.